Hello. In this video, I'm going to go ahead and cover healthcare, Medicaid, and Medicare reform. It may briefly touch on the Affordable Care Act and Obamacare. However, there will be additional videos that will cover those issues in more detail. As state representative for the 131st District, we advocate for healthcare, Medicare, and Medicaid reform that best balances helping the healthcare industry to remain competitive while improving access to healthcare for all residents and businesses, and closing loopholes used by the healthcare industry to selectively refuse patients based on their accepted form of payment or type of insurance. This position could also benefit Missourians on a state level as well as regional, district, or federal. There is currently a nationwide epidemic. Missouri and Springfield are no exception, where doctors, clinics, and hospitals are engaging in an unethical practice of selectively refusing to treat patients due to the fact that their medical issues would require additional or extended time and testing procedures for which they believe Medicare and Medicaid do not adequately compensate them for, and as such, these patients are being denied access to health care and treatment for which they have had access to prior to April 1st, 2015. These same doctors, hospitals, and clinics have agreed to accept these payments as part of their participation in the Medicare and Medicaid payment programs, and are selectively not doing so and hiding behind existing laws to create a loophole to allow them to do so at the great risk to injury and death of some of those patients through the denial of access to health care. This loophole needs to be closed, and other options for affordable health care need to be looked at and possibly put in place of Medicare and Medicaid. Would it be better for Americans if they were on a private insurance plan with the nation's largest insurance plan providers such as Cigna, Aetna, United Healthcare, and so on, and Medicare or Medicaid simply paid their premium for them? That would give the healthcare industry a greater reimbursement on services and tests, as the mainstream insurance companies reimburse at a negotiated rate of somewhere around 80% of reasonable and customary charges and fees, where Medicare, as of April 1st, 2015, reimbursement dropped from 80% to 60% under the Affordable Care Act. And Medicaid in Missouri, I believe, is reimbursed at somewhere close to 50%. Medicaid reimbursement is currently around 50%, and Medicare reimbursement is currently around 60%. As a direct result of the Affordable Care Act provision that went into effect at the time, reducing the Medicare reimbursement to providers by some 20% from 80 to 60%, causing this denial and refusing to treat by the doctors, hospitals, and clinics. Now keep in mind, previously the doctors, hospitals, and clinics were all for the 80% as a means to pass the Affordable Care Act, knowing that it was going to expire on April 1st, 2015. Now that it's expired, well, now they refuse to treat patients. There are options and solutions out there that can be looked at, and I intend to look at these issues and work with leaders and lawmakers to pass and introduce new legislation and bills aimed at addressing these issues and provide the residents of the district as well as the state of Missouri with the best possible access to health care, both in the emergency room and in the doctor's office. Thank you.